tips like that. 3 tips. So in the US, we have our national conference is the American Academy of Osteopathy Convocation. That's our national conference. I didn't discover that conference until I was a 4th-year medical student. I didn't start attending it, besides that one time, I didn't start attending it until I was at the end of my residency. So you have 4 years of medical school and then 4 more years of residency training. So I attended it once as a medical student, and I didn't attend it again until my 3rd year of residency training. And I wish that I had been attending since I was a 1st-year medical student. And I probably couldn't have attended during internship year because it's too hard. But the other 3 years, I wish I had attended that convention sooner and I took courses when I was a medical student. I wish I had taken even more courses during my training, in addition to my residency training. Is that 3? That's 2? I need a 3rd one, to find more mentors.
Mentors, okay.
More mentors, as many mentors as possible. I tell my students this all the time. You need as many mentors as you can possibly have at different levels of training. So someone who is 30 years out has this lifetime of experience and seeing patients and seeing different circumstances and seeing the politics of organizations and things like that. But they don't necessarily know what the application process looks like for residency. They don't necessarily know what the job market is like for someone fresh out of school. And so they can't address those things. So you need a mentor who's right above you or a few years ahead of you, because the environment that you're going into is more similar to their experience. And so you need mentors at different stages of their career, because each one of them brings something different to the table and can help you in different ways. And you don't know what you don't know. So you don't even know what questions to ask. And so by having conversations and talking to different people and expressing just what your fantasy is about what you want to achieve and what you want to contribute, they help you to ask better questions. They help you to know what's beyond your horizon and your experience. They connect you to different people who are doing similar things, which is why it's so important to just talk about what you want, even if you have no idea how to get it, because hopefully you're around people who have a better idea than you do and can connect you to those people. I think a lot of times people are scared to express what they're interested in because they're afraid of failure, or they're afraid that the next question is going to be, so how are you going to do that? And they're going to be put on the spot. But especially when you're young, but I would say this is true throughout life, it's most important just to talk about what you aspire to do, even if you don't have a plan, because again, you never know who's around you and who they can connect you to. So many of my experiences, so many of my successes came because I just was talking about what I hope to do, and people next to me, again, at different levels of experience, were able to connect me to people. It may not be their interest, but they know someone else who is doing that work, or someone else who's interested in that work and can help me along the path. So that is part of our training in the US, is that we talk about mental health. I don't think we talk about it nearly enough. And when we talk about the 4 tenets of osteopathy, we say mind, body, and spirit. But we almost always exclusively talk about the body, and the mind and the spirit is ignored. We had a conference for convocation several years ago, and it was on mental health. Because when we looked at what we had done for our themes, mental health was never addressed. How can we call ourselves osteopathic physicians? And we say mind, body, and spirit, and we want everyone to recognize us for mind, body, and spirit. But when it comes to the actual conferences, when it comes to the actual teaching, never one of the themes. It's absurd. So, I think that it's something that we have to drive back, and it can't be something that's dismissed, because we know that our emotional and mental state affects our physical bodies, right? I use that as a vehicle to talk about mental health with my patients. So if I'm treating them and I feel their head and their head has dysfunctions, or I feel their trapezius muscles and they're clamped up, they're coming to me for headache or neck pain or shoulder pain. That's what's bringing them to the office. And I feel these things and I feel the patterns, because people carry their stress in their jaw, in their shoulders and their neck, and in their stomach. Those are the three places that people carry their stress. So when I find these places and I touch them and they go, oh, that hurts. And I go, yeah, let's talk about it. How much stress do you have? And they start rolling their eyes. And I go, okay. But you understand, I can fix you and I can give you stretches and I can do all these things. But if the real source of the problem is that you have a bad relationship with your partner or with your boss or with your children or with your parents or whomever, and we're not addressing that, this will go on forever. Yeah. And so that's the real source. I would say, it's going to sound really cheesy, and I'm so sorry, and cliche, but listening without judgment and with empathy, listening with your hands, listening with your ears. I think those are two really big things that we overlook. Because if you don't trust me, you won't share with me the details that I need to know to help you. If you don't trust me, when I go to treat you, you clench up. If I give you a treatment plan, you won't follow it. But that trust comes from your belief that I'm on your side, that I don't think negatively of you, and that I sincerely want to help you. And so that requires me to listen without judgment. Whatever my particular values are, whatever my particular predispositions are, as an osteopathic physician, I wholeheartedly believe that we are here as guides, informed guides, educated guides to our patient. Ultimately, your health is your responsibility, and I'm here to support you in that goal. But I can't support you if I'm judging you. And you can't be supported if you can tell or perceive that I'm judging you or looking at you negatively. So I would say listening, both with your ears and your heart and your hands, is critical. But in terms of osteopathic medicine, I would ask them, what is their approach to treating patients that's worked the best for them and why? If you say, oh, what's the best way to treat a patient, or what's your best approach to treating a patient? That's that one expert's answer. Unless they're omnipotent, I don't know how they would know for everyone.
Yeah, maybe it works for them.
It works for them, but not for someone else. For any number of reasons, pure talent, body size, how they're perceived by patients, the population that they treat, any number of things. And so I would want to know more about their process. What's the best way that they've approached patients, and why has that worked best for them? Because that gives me insight to their process of how they got to the answer. I can apply the process to myself and my particular circumstances. I don't know how you separate those two things. To me, intuition is a sixth sense about what is. Science is just a study of what is. So intuition is just somehow you know, even though logically you can't necessarily explain. Just because I can't explain it doesn't mean I don't know it. But they're both, hopefully, trying to address what is the reality that you're dealing with, whatever that is. So whether you're talking about treating a patient or you're talking about sensing danger on the street, it's just knowing. So I can say scientifically, oh, it's dark, it's a dangerous neighborhood, I'm by myself, this is a dangerous neighborhood. Or I can just sense, oh, I'm in a crowd, then there's something wrong here. You're both trying to evaluate what is the reality that you're dealing with. The reason that I'm drawn to osteopathic medicine is because it acknowledges both as valid.
Thank you so much.
Thank you so much. It was great to talk to you.